Good evening. You're listening to Fresh Air Community Radio, KFAI 90.3 FM in Minneapolis, and we're streaming online at kfai.org. And this is Health Notes from the Hearts of a Natural Woman, and I'm Kinshasa. Even after 3 pandemic years and more than 100 million COVID-19 cases in the United States, the medical community is still unclear how and why certain people develop long COVID and are even further confused on how to treat it. Since the start of the pandemic, nearly 38 million adults in the United States have reported post-COVID symptoms that lasted 3 months or longer. As far as symptoms go, many report fatigue, brain fog, shortness of breath, heart palpitations, and muscle, joint, or chest pain. Danielle Pashko says many of these long COVID symptoms are similar to Lyme disease symptoms, which can present as extreme tiredness, headaches, fever, joint stiffness, and muscle aches and pains. The CDC reports that because of climate change, warmer average temperatures can mean longer warm seasons, earlier spring seasons, shorter and milder winters, and hotter summers. All conditions that become more hospitable for many carriers of vector-borne diseases like babiosis, a tick-borne illness that has increased significantly this year in many Lyme disease hotspots in the Northeast. Danielle Pashko says while difficult to treat, both Lyme and long COVID can be managed to suppress unwanted side effects by adopting strict lifestyle habits, including compression therapy, mushroom supplementation, anti-inflammatory diet, acupuncture, yoga, meditation, and prayer. She emphasizes that while hard to diagnose illnesses frustrate doctors, patients do not have to live in limbo while waiting for a cure. There are actionable lifestyle choices that can be made now to minimize debilitating flare-ups of these illnesses so you can live your most productive life. Danielle Pashko is an author, holistic nutrition expert, certified health coach, and yoga instructor. Tell us a little bit more about your history and what you've been doing and how it led you to solution to things that we're told have no cure.
Well, I've been working in the holistic health field for the past 2 decades, and I always noticed people coming into our practice with different chronic illnesses. And at the time when I first started working, I was healthy and didn't have any of these issues. And about 5 years ago, I didn't realize that I was bit by a tick, and this can happen to a lot of people, and it can go undiagnosed for a long period of time. And I never saw the classical bullseye rash, which people think is associated with getting Lyme disease. And what happens when people are in an environment, a woodsy area, or they're hiking, or they're maybe by deer or things like that, they could actually get bit by a tick. Even their dog can bring home a tick, and they may never see the rash and can start to have a myriad of strange symptoms. And that happened to me. And if you actually see a tick on you and you discover that you have Lyme disease, you can go to the doctor, get a round of antibiotics, and typically that's enough to knock out the infection. What happens and how it becomes chronic and very difficult to deal with is if you do not know that you've been infected. That's what happened to me. I realized a year later that it was actually that I did have Lyme disease, and at that point it can become chronic. And then you start getting a lot of inflammation in the body, and symptoms can, there's over 200 symptoms that you can have from Lyme disease. I mean, it can range from fatigue and brain fog and joint pain and dizziness and migraines. from people to being bedbound. So a lot of things can happen. Fortunately, after experiencing many of the symptoms that I just explained, I was really able to pull myself out, and I really had a lot of gratitude that I was able to heal through doing different alternative therapies. Once the onset of COVID came along, I considered myself healthy once again and in very good physical shape. I had a very mild case, and this is in the beginning of COVID, actually, when it was still the Delta variant, which was a very strong variant, but it didn't even hit me that strongly. And I thought I would just have 10 days of feeling like I had a bad cold and I would recover like everyone else. I didn't recover like everyone else, and my Lyme symptoms came back. It's interesting because Lyme and COVID are so similar, and that they're both diseases of inflammation and also immune dysregulation. The way they present are so close to each other that it's almost hard to tell which one you have. So I am seeing an uptick of long COVID, unfortunately. Also, Lyme disease as well. So these are two things that I really keep my eyes open for, and I have to work with clients to help them.
Here in Minnesota, we've got a lot of ticks here.
Wow, yeah.
So when you're talking about people maybe not knowing for 4 or 5 years that they've been bitten and that they have this, is it still treatable?
It's still treatable. It's just that you're in a different stage. It's you become a person who's dealing with chronic Lyme versus a very, an acute infection where you're able to treat it. So the treatment becomes a lot lengthier and also more repetitive and takes a period of time to heal. It's not like you can do a treatment for 4 weeks and it's done if you've had Lyme for years already. It will take some time to get better, but it is treatable. I mean, I was an example of that. I was really, really sick and I was afraid that I would never recover. And I did manage to recover. So there is hope for those people, but you need to work with the right practitioner.
What seems to be the recommended protocol for Lyme is that folks who have it will be on antibiotics for the rest of their lives.
No, they won't be. Actually, the antibiotic part, no. If you have a case that you catch right away and you are able to take antibiotics, that sometimes is enough to stop it from progressing and you can be okay. If later on in life you find out, let's say a year or two, 10 or 20 years later, that you have Lyme disease and that's explaining some mysterious symptoms that you may be having, typically your doctor will give you antibiotics as a first-line therapy, but there are many other things that need to be addressed, especially regarding diet and supplements and lifestyle practices. And there's many things that I suggest to people that are very helpful that you should do in addition to antibiotics, because that alone, once it becomes to a chronic stage, will not be enough. And I'm happy to share those things with you.
Absolutely. And I'm just curious, Danielle, when I think of antibiotics, I know that it kills the ecosystem of the gut. So
That's true.
I'm a little confused as to, on one hand, you're killing the ecosystem of your immune system, and on the other hand, you're killing something else. I guess there's a disconnect in my head.
That's where there's a problem. You're right. There is a disconnect, because to have a healthy body and to promote immunity, like you said, a healthy ecosystem, the gut microbiome is where 70 to 80% of your immune system lives, right? So it's very important to have a healthy gut. So when you're having those antibiotics, it wipes out that healthy gut flora, absolutely. The problem is that Lyme disease is a bacterial infection, and the way that they treat it is with antibiotics. So that's why you need other supportive therapies to help you regulate your immune system and get your gut health back on track, because otherwise you can, like you said, it's definitely not healthy for you. So you don't want to rely on just antibiotics.
We're talking with Danielle Pashko this evening on Health Notes, and we're talking about sometimes hard to diagnose, And certainly there's hard solutions for Lyme's and long COVID. The thing that's so interesting about long COVID, for so long, they were just telling folks that it was in their heads.
Yeah.
And it's so important, the work that you're doing. I'm hoping that you can share with our listeners what can we do nutritionally to support ourselves. I am a colon hydrotherapist, and I
Oh,
have
wow.
have clients that have been on antibiotics for a couple of years,
Mhm.
and they're just, it's not a good situation in terms of amount of drugs that they've been given and how it's depleted their system. Is there a way of being able to build our systems back up?
Yes, and I completely agree with you on that. Well, the first thing I like to recommend is an anti-inflammatory diet. And this actually goes for both Lyme and long COVID, but really any kind of chronic illness, because all diseases have a component of inflammation. When you talk about an anti-inflammatory diet, we're really meaning to take out processed foods, which you know are not good for us, anything fried, sugar, gluten, even coffee for a lot of people. It can be a little intolerable, and alcohol for some people, not good for them. And really focus on a diet that's more colorful fruits and vegetables. You want to make sure that they're organic because you want to avoid pesticides and herbicides and things like glyphosate that can be inflammatory. If you want to have any kind of animal protein, if you're going to have fish, make sure it's wild, or if you're going to have meat or poultry, make sure that it's organic and grass-fed, and also really focus on good healthy fats like olive oil and avocado, and homemade broths are very good, and fresh green juices. These are things that are easier on the digestive system. To bring down the inflammation, that's really the first place that I start. Another thing that really helps with inflammation and also modulating the immune system, because when you have either of these syndromes, your immune system becomes very dysregulated. You have to be concerned about reactivated viruses that can occur as a result of having either of these syndromes. So, for example, let's say you had Epstein-Barr, which is the virus that causes mono when you were a child, and now you're an adult and you're getting one of these Lyme or long COVID. Sometimes your immune system is so suppressed that you find that these old viruses are reactivated and you're actually becoming symptomatic. So I recommend a mushroom therapy. I think it's really terrific. And the one that I work the most with is one called AHCC. It's the most researched, and it's very good for modulating the immune system. It's anti-inflammatory, and it also is antiviral, because we talked about these viruses that sometimes come up. It also works as a prebiotic, so it really helps the gut microbiome. So that's one that I definitely recommend. In addition to those nutritional therapies, there's some other things that I can share with you as well as another type of therapy that's not nutritional, but they work well if you would allow me to share them with you. Compression therapy is something that I do first thing in the morning every day, and I recommend this to people. And I'm talking about people, sometimes can wear compression socks or things like that, but I'm actually referring to compression boots. And they're electric, and they actually compress your legs. They promote a lot of circulation, because what happens, especially when you're looking at long COVID, people have to be concerned about blood clots or not having good circulation. Neuropathy comes up a lot, nerve damage. Also, what we see with people with both syndromes is something called orthostatic intolerance, where they have issues regulating their heart rate and also their blood pressure. They can get what's called tachycardia, where their heart rate gets very high and their blood pressure drops. So believe it or not, doing these boots can actually help blood pressure, heart rate, and also help to manage anxiety, because it's very anxiety provoking. If you have these issues with your heart rate or your blood pressure, your body's going to feel it. You may even feel dizzy. So this is very good. And also, if people are chronically ill and they're in a place where they're not able to exercise very much, the compression therapy really helps them to at least get that circulation. So if they're not able to do much movement, they're not just sitting stagnant. So you can get a very expensive pair of compression boots. Normatec is one brand. It's very expensive. Or you can go on Amazon and get a $100 pair of compression boots. I have both, and truthfully, the $100 pairs are great. I travel with them all the time. So if you're on a budget, this is really something that I recommend as a home device to do daily.
We're talking about hard to diagnose diseases this evening on Health Notes. Where we ended up, Danielle Pashko, our guest, was talking about specific protocols that we could use to help the symptoms that we might have of Lyme's and long COVID.
Acupuncture is really terrific too. A lot of times you can get your insurance to cover it. And it's so good for pain and migraines and digestive discomfort and even a depression and anxiety and especially sleep. And these are all kinds of issues that people tend to deal with who may have either one, Lyme or long COVID. So acupuncture is terrific. Yoga is another one that I think is so important because it's a way to move in a restorative way where we're not stressing the body. And what we find if you have Lyme or long COVID, many times too vigorous of exercise, while exercise is recommended for most healthy people, exercise can cause post-exertional malaise. So it can actually make you feel worse if you're really stressing your adrenals and working out too hard, especially when you don't have the energy. So just doing the restorative yoga, focusing on the breath really helps to just calm you down. It calms the nervous system, which already may be a little haywire because you're just anxious of having these symptoms. And the last one I recommend is meditation and also prayer. You know, prayer is sort of subjective if that's something you're comfortable with, but even meditation and getting into a mindset of just quieting yourself and really getting into a gratitude practice. And it helps you to be more hopeful. And also when you get into that mindset, it just helps to rewire the brain to really start to believe that you're moving towards a place of healing. You need to stay calm through this process. The brain is really sends signals throughout the body. So these mind-body practices, in my opinion, are really, really critical for pretty much anyone who's dealing with this.
The mushroom therapy that you talked about, does someone need to go to a naturopath?
So to get to AHCC, you don't have to go to a naturopath. While a lot of naturopaths and even some hospitals are using this, or functional medicine doctors. I worked with a doctor in functional medicine about 20 years ago, and he was very big on AHCC, but you can actually even get it on Amazon. There's different brands, but if you're going to use a brand, I think one of the most reputable is called Quality of Life. I try to find therapies that are accessible because a lot of people who are dealing with chronic illness, they spend tens to sometimes hundreds of thousands of dollars in treatments, and not all the therapies that people do are necessary, right? It's sometimes very scary because you say, how can I afford to do all of these things? And really, if you have very good nutrition and you're working with the right supplements and you're calming the nervous system and doing the compression and you're doing a lot of these types of modalities, it's really accessible to anybody. And that's what I want to see happen, because I don't think it's fair that, you know, certain people have to feel like they can't have accessibility to getting help because it's out of reach for them financially.
I'm just wondering, for you, was the inflammation less and the symptoms less because of how healthy you are and because you're a yoga instructor?
I think that it's definitely helped. Having a healthy lifestyle makes a huge difference. I've always been very active. So I think that my recovery was probably a little, I would say, quicker than maybe some other people who never took care of themselves and now are finding that they have to make these lifestyle adjustments. But I still got hit pretty hard. It's something that I guess was an advantage to be healthy to begin with. But it's really, when you get any of these syndromes, even if you are a very healthy person, it can be quite debilitating. So you still have to take a lot of action. and continuously. I mean, I really, really watch what I eat. I love to have a glass of wine, and I love to, red wine is not necessarily the most inflammatory thing if you can tolerate it, but it can affect people, especially with long COVID. I can no longer tolerate wine. So there's certain things that I don't do, and I'm more conscious than I used to be, but it's a work in progress. And every day I just really make sure that I'm pretty consistent with my rituals. And I think that really helps. And lowering your stress levels is very important for inflammation because you can do all the natural therapies in the world, but if you are completely stressed out and anxious because of what you're dealing with, that is going to create inflammation as well. So it's something that we just have to all focus on practicing as much as we can if you are dealing with any of these conditions.
So will Lyme stay in your body for the rest of your life?
It does, unfortunately. It can go dormant. It's like one of those things that it's always there. It's like any kind of virus that you may, like if you have a herpes virus or even HIV, you can have these viruses, but if you can manage them, and Lyme disease is the same, as long as you keep it under control. For me, when I had it and it actually went to a dormant state and I wasn't experiencing the effects, I was doing pretty well. But if I, let's say, went a couple of nights and I didn't sleep well, or maybe at the time I had a couple drinks or something that I knew wasn't so good for my body, I may get a flare and notice like, oh yeah, I have to actually take better care of my body. Even as a practitioner, we want to live life. We want to have a good time, and not everyone is perfect and we're not purists. It can be suppressed and be pretty dormant, but then it can recur. So that's why you have to try to live as well as you can so you're not dealing with these flare-ups.
In case you just tuned in, we're talking about solutions for hard to diagnose illnesses. Expert Danielle Pashko, author, holistic nutritionist, yoga instructor, is talking to us about Lyme's disease and long COVID. Share with us, Danielle, your experience with long COVID.
When I first finished, the first time I had COVID, I've had it twice so far, and the first time after I had it, I expected to just bounce back and feel normal again, but I had a lot of the same symptoms that I did with Lyme disease. I had blurred vision. I had a lot of severe dizziness, heart palpitations, fatigue. It was actually quite scary, and I thought it was just a reactivation of Lyme. But I realized that it's very strange that these two diseases, because they really have to do with excessive inflammation, they are so similar. The therapies are also very similar for both of these syndromes. So it has been something that has improved. I can't say that I'm 100% better from it. It definitely takes time. Most long haulers who have it severely have it for a period of time, whether it's a matter of months, or I even see people now that have had it since March of 2020. So it's something that I really work hard to manage. It's a journey. I imagine that within time and continuing my practices that I will fully be able to pull out of it, but it is something that I have to work on. But for the most part, I live a very functional, normal life. I work full time and I have a social life. I just have to make lifestyle modifications to minimize flare-ups so I can feel okay. And it's just being more conscious of your health than I probably would have been prior to this. I don't overexert myself. I don't make too many plans in terms of, if I look at it an entire scope of a day, I really pace myself. I try not to do too much at once because I think you don't want to overwhelm your body. You can only handle so much, and you have to baby yourself a little bit. So I look at my body as in a healing state, and I do things at a slow pace. I do what I can do. I don't take on too many clients at a time. And I think that really helps me get through it. So I think pacing is a very big part of it. And I sleep a lot more. I mean, it's not a matter of being lazy. It's a matter of being healthy. Sleep is really where you rejuvenate and you get a lot healthier. So if anyone is dealing with this, I would say try to get to bed at a really reasonable hour. Definitely like by 10 or 11 o'clock. You don't want to go to bed at 12, 1, 2 in the morning. That's no good. It's not refreshing and restorative sleep. So I sleep a good 8, 9 hours every night. And that wasn't me. I used to be able to function on 5, but that's how my life has changed. I'm continuing to get better every day. So I just hope that's just a trajectory. I believe it is. And the people that I've worked with, I'm definitely seeing improvement with them as well. So we can just hope that continuing to do these practices is really going to make a difference.
How did you find out that it was long COVID and not the Lyme?
There's no actual test for long COVID, but I had new symptoms in addition to the Lyme, which were very consistent with people going through long COVID. And for me, it was I developed something called POTS syndrome, which can be diagnosed from a neurologist, and also some neuropathy in the body, which is some nerve damage. What POTS syndrome is, from sitting to standing, your heart rate raises over 30 beats per minute. So I would stand up and I would have a normal resting heart rate, let's say in the 60s, which is quite healthy. And then I would stand and sometimes my heart would go into the 120s. And I was wondering, what is going on with me? What is this? And I saw 2 cardiologists and I realized quickly that a lot of people who were getting long COVID were having issues with this type of POTS syndrome and also neurological issues, neuropathy, and this was something that was happening to many people. And it's a lot of what I've seen with clients, and I started to see the patterns. Also, I noticed in my lab work that I had reactivated viruses. So, for example, the Epstein-Barr virus was reactivated, causes mono, and I thought that was suspicious. And some other things other viruses that I had as a child were reactivated, which were making my immune system not work as efficiently. So while there is no test for long COVID, what people can do is go to the doctor and request a viral panel that can check to see if you have any of these viruses that are reactivated, and also check for autoimmunity. There is a blood test called ANA, which is autonuclear antibodies, and shows if you suddenly have a newly found autoimmune condition that could be a result of long COVID. So you have to just start piecing these things together. Also, seeing a neurologist is a good idea if you're having neurological, cognitive issues, brain fog, if you're having any of these issues with your heart rate and dizziness and that sort of thing. This is a hallmark symptom of long COVID. So there is, unfortunately, I wish you could say there's a blood test that says, oh yes, check, you have long COVID. It doesn't exist. But if you start to piece these things together and they're going on for a period of time, and this is different than what I had with the Lyme. So I knew quickly that, okay, I'm a long hauler. That's what happened. And I think people just are not necessarily going to the right doctors to get the right testing done. And then they're concerned because they're like, why am I feeling so strange and so unwell? But if they can start to piece these things together, then they can address it. And that's why also the AHCC, especially when I saw these viruses start to reactivate, I made sure to start taking that regularly because that is antiviral. Of course, there are antivirals you can take, but some can have side effects. And I really try to, there's a time and place for all kinds of medicine, but I try to stay as natural as possible. So that's why I started to really work with the mushroom therapy.
When we're talking about Lyme and the long COVID, what are the effects on the mind and on your spirit?
It can be very, very hard on your mind and spirit. Whether it's this or whether it's any kind of illness where you just don't feel like yourself, it's different feeling like you're in a body that's not the same as you're used to, especially if you're one of these people who were originally healthy and vibrant and practiced yoga and ran and hiked and did all these things, and now you're experiencing this. It can be very hard. That's something really that we all need to work on, and that's really where I try to go into doing my meditation and doing my prayer. And also there's another program, it's called DNRS, which stands for Dynamic Neural Retraining System. And it actually works on the limbic system on the brain to help rewire the brain to not stay in this negative feedback loop and really get yourself in a place of healing. It's very interesting. So I was doing this DNRS exercises and really working a lot on my mental state. Also, I recommend therapy for people because I think it's important to have an outlet, especially when you're dealing with an invisible illness, because both of these, Lyme, long COVID, you don't necessarily look sick. So most people, especially with long COVID, right, or COVID, they have COVID, and then after they're done, they're better. So imagine if you're not feeling well and people start to think, even your doctors who don't quite understand this, if they're not very confident in dealing with long COVID, they may tell you it's all in your head. And if you hear that from enough people, it can be really psychologically damaging. You have to trust yourself and know when something is wrong and be able to work through that without listening to other people and without believing them, because you know your body better than anybody else.
What an investigator you are. And
yeah, you have to be. You have to be. I mean, it hasn't been a fun process to go through, but I think along the way, learning how to deal with this myself, I think has really helped me to have an understanding of other people, and, you know, hopefully I can be of some help, or at least, you know, share some of these things so people are not so frightened by it, because there is a way out. I mean, our body has an innate healing way of healing, and we're supposed to be healthy. And sometimes our immune systems get dysregulated and go off track, or we have things happen to us, but they don't have to be permanent. So I just, if anything, would like to help people to just, you know, instill some hope, because it's easy to lose hope, but there is a lot of healing occurring, and I do see really good outcomes of people over time, and even myself as an example. So it's just something that, stay the course, and you can really see an improvement if you stay the course.
you know, you could have kept all of this to yourself. You didn't have to share it with the world. Thank you. Thank you so much.
Well, thank you for the opportunity.
Danielle Pashko this evening
Thank you.
on Health Notes. Thank you so much, Danielle.